so many PT clinics have these tables. They're
High-low table.
Yeah, and hospitals too.
Yeah, that's right.
With the hospital bed.
Yeah.
And what we find is a lot of times if we can, in a hospital situation, just getting people moving, right? But in a PT situation, getting them warmed up for whatever it is that you're going to be doing with them. So maybe we can talk a little bit about how to leverage, these tables and using Excy, as a cycle on the side.
Yeah, well, there's the warming up aspect in an outpatient rehabilitation setting, but it is also developing range of motion. So on something like this, you can just work half circles or a limited arc just to work on early range of motion, say for a knee or a hip. Now, in the setup, we'd say square the exercise equipment to the edge. On this edge of the table, it's kind of we'd say oblique to the line of the table. So you'd offset that such that the Excy is perpendicular square to the front edge of the table. That's going to allow you a more stable perch. Now, with regards to this exercise equipment, how this varies or is different than, say, like your typical recumbent bicycle or standard exercise bicycle is the crank is a little shorter. So that's a good thing, particularly for earlier range of motion development or just use in this situation. So if we were to raise the table up,
am I allowed to move forward?
Totally, but that demonstrates the need for you to readjust your perch, if you will. But in elevating the table, what that does is that means that you have to reach a little farther through that pedal stroke, which also means that the knee doesn't bend quite as much at the top part of the pedal stroke. So for our people who are limited in range of motion, particularly knee flexion or hip flexion, they'll have better tolerance of that activity a little higher up rather than low. So sometimes you can then, if you start out high and we're, say, progressing their range of motion, you can bring them down. Now, clearly, we know that with bicycling, a greater degree of knee flexion through the pedal stroke with prolonged exposure to the activity puts you at greater risk for knee pain. So, for a clinical setting, it's not practical in the clinical setting for us to have a person ride this or pedal this for an hour. So, you can expose them to these deeper knee angles just for the development of some range of motion for a shorter period of time. But if they're doing a longer period of time, say you have them doing like a 10 or 15 minute warm up prior to your session, then maybe you'd set them up a little higher to where it's a healthier position for the knee and hip. And they can just cruise along.